gosh, I have no idea what to do in the midst of a public health emergency, despite my pretty extensive public health career and my exposure to those messages. It was definitely a very bright light bulb that went off. It was a little personally alarming.
We have all experienced a pandemic, extreme weather events, and other types of emergencies. But people with complex healthcare needs and their families feel the impact of these events in deep, unique ways.
That's surprising that it kind of just like getting into that moment, like being asked to recount it is kind of amazingly emotional.
Took me back to when one time situation in South Sudan happened. At that time, you cannot think of anybody, you can't think of anything, you just want to put your head where you feel it's safe. So it took me back to that time.
We ourselves have to be prepared in order to be ready to become a support in the case of an emergency.
Families, community leaders, and professionals expressed toolkit fatigue and wanted multimodal, interactive products to build their knowledge base and capacity to respond during public health emergencies. Public health must be flexible, adaptable, and responsive to feedback from its workforce and communities. This project centered collaboration and partnership, which is foundational in elevating the stories from individuals, families, and communities with lived expertise. Narratives from people with lived experience are invaluable because they shed light on factors that impact outcomes, yet are often invisible and ignored.
Birthing people are actually really a vulnerable population, especially when it's an emergency. They are also very vulnerable if they're living in communities that refuse to address issues of really preparing all parts of the community, including pregnant people, in their plans.
What it did for me is it just caused a focus that's what we had to do, and enlist our staff, individuals, to figure a number of these issues out. To get all those pieces to fit was really quite an amazing activity to be a part of, especially to start seeing things being able to come together.
You're in your mind, you have your policy, you have your written instructions, you have your procedures, you got your head in the game, right? And then the heart space is like, wait a minute, okay, is there any message that comes out to the families?
We can start to think a little wider and expansive in our approach to make sure that all families have the support that they need. It's something that should be thought about all year long. It shouldn't just be thought about only during hurricane season. But disadvantaged communities are oftentimes already struggling, and so having to flee and now incur other costs to evacuate is often a burden for them.
Qualitative data, like stories of lived experience, are critical and necessary complements to other forms of evidence, like population-level data about the impact of a particular disaster. These stories answer the questions of how and why, as well as add context to known and unknown facilitators and barriers. How did successful efforts come together? Why didn't other efforts work?
I felt I've grown and I'm strong enough. I can handle emergencies, but when that time happened, I could not even understand myself. At the same time, trying to be strong and let the kids see me as their mom, not in a panic, but strong so they can also stay strong.
There was an amazing delight and energy that existed not only with myself, but the staff who were doing that, and the relationships that we established with the folks in Louisiana as well.
We want to thank everyone for their powerful contributions to this project. Emergency outcomes for people with complex healthcare needs and their families improve when we see their strengths, listen to their needs, and plan with intent. To learn more and take action, visit bit.ly/all capital AMCHP-BRFLE.